Hello there, my name is Justin Intorcia and I am the Assistant Program Coordinator for the Florida State University Internal Medicine Residency Program at Sarasota Memorial Healthcare System. I am thrilled to welcome you virtually to SMH, and we hope that by watching this video you get a better idea of all that our program and community have to offer. Before I show you around, I want to tell you a little bit about Sarasota Memorial, which has a rich history as the county's first modern hospital, and one that has been taking care of this community for more than 95 years. From our humble beginnings in 1925, SMH has grown and changed quite a bit over the years, and we continue to grow and expand our services. All of this is possible thanks to the fact that SMH is a mission-driven hospital governed by a locally elected hospital board. We also have a healthcare foundation which continues to provide millions of dollars in grants to enhance our patient care, facilities, medical research, and technology. The goal of the SMH Internal Medicine Residency Program is to help our residents become caring, well-rounded physicians who consistently demonstrate compassion and excellence.
So many different types of patients that we see, not only clinically, but also culturally. And I think that does help us as physicians, as we're in training, to go out after residency and be able to care for all types of people and not feel that you're being thrown into a situation that you weren't well prepared for.
Our team of highly specialized trauma surgeons, emergency physicians, subspecialists, trauma and intensive care nurses, and rehabilitation specialists stand ready 24/7 to deliver immediate, life-saving care to people who suffer the most severe injuries in or near Sarasota County. We also have the region's most comprehensive and advanced cardiac and stroke programs. First-year internal medicine residents work collaboratively here with the residents from SMH Emergency Medicine. Our residents rotate in the ICU during their second year and collaborate with the emergency medicine residents along with the third and fourth year medical students from FSU. Our rounding structure utilizes an interdisciplinary approach which dictates multiple levels of interaction that occur on a regular, ongoing basis throughout the patient's stay between the physician and other members of the care team. In our ICU, we have dedicated intensivists who work hand in hand with our residents to ensure that we provide the best possible patient care. Our teaching teams are divided equally between 2 patient care units. In addition to the nurses, case managers, and pharmacists, the team consists of a senior resident, 3 interns, medical students, and 1 attending physician. Our transdisciplinary approach to team rounding ensures quality care and the best possible patient outcomes.
Caseload and patient population here is just incredible. I mean, I remember seeing certain like pathologies on like the last slide and then of a lecture in medical school with like 1 line. Learning about it, 4 years ago, and then all of a sudden I'm seeing a patient who actually has this pathology, and that happens daily. I mean, I see that all the time. People come in here super sick, really rare pathologies, and you just get to see a variety of different cases. And there's always learning opportunities with basically every single patient that you come across.
We have a dedicated conference space known as 4C, in which we hold academic half-days and noon reports. Here, we are able to hold interactive and collaborative sessions.
We have very strong didactics. I really do think that no matter what avenue you want to take, whether it's fellowship or internal medicine, primary care, hospitalist medicine, that this program will back you.
Our new resident dictation room has more than 10 computers for residents to work on notes and orders. We utilize the same EMR here as our Newtown Internal Medicine practice, a continuity clinic you will learn more about in a separate video. This makes for an easy transition of notes and orders from the hospital to the clinic and vice versa. Sarasota Memorial strives to be a great place, not only for our patients, but also for our staff. We care about our residents and ensuring a healthy work-life balance, making sure you get proper nutrition, sleep, exercise, and time off to enjoy all that our community has to offer.
Residency doesn't just stop at the hospital. As a resident, you have to have a good balance between residency as well as your own life. So being in a place where it allows you to go out of the hospital and kind of remove yourself from all that stress of everything that's going at work makes it easier.
In the graduate medical education offices, we work around the clock to make sure that the program runs smoothly for our residents, and we'll do all that we can to make the transition into residency as easy as possible. We truly are a family here at SMH. We are so proud of the incredibly talented and caring physicians who have come from the internal medicine residency program.
Knowing what I knew then and knowing what I would do now, I would choose SMH all over again.
I feel like I made a great choice. So for me personally, the biggest thing was I was going down one path. Started realizing it wasn't for me. I did a critical care rotation here at SMH, and immediately I knew these guys can train me. These guys will get me where I need to be going.
If you're considering a program where you're going to grow from a clinical aspect as well as personally, you have to consider FSU SMH.
Thank you so much for joining me on this virtual tour of the SMH campus in sunny and beautiful Sarasota, Florida.